prior to CAR T infusion, all patients receive lymphodepleting chemotherapy. And so what our thought or hypothesis was that the lymphocyte expansion in the first 2 weeks that we see in these patients is primarily due to CAR T expansion. And there is no clinical test to actually say, that this patient has a CAR T expansion going on or not. So we thought that maybe if we use CBC differential as a surrogate test, we can ascertain that what's going on. So in our study, we had 87 patients, and we found that ALC peak in the first 15 days was associated with treatment response. So patients who had a higher ALC peak had higher rate of CR and also durable CR. And by durable CR, I mean CR in the first 6 months post-CAR T. And also we then looked at it in the lab and found that increasing ALC levels also correlated with CAR T cell expansion. So those would be the main 2 points. And lastly, also that patients who had a higher ALC peak also had longer PFS and OS. So that kind of helps to know when we have a patient in the clinic that how this patient is going to fare eventually.